name is Kristine Freeman.
And I'm Savannah Hooper.
And today we'll be discussing our research poster over the barriers for veterans seeking civilian/post-military employment.
A veteran is an individual who has served in active Army, Naval, or Air Service. To be considered a veteran, the individual must be discharged or released for reasons other than dishonorable discharge. Achieving veteran status allows individuals to receive many benefits from the U.S. Department of Veterans Affairs. Benefits can include disability compensation or pensions, education and training, home loans, insurance, vocational rehabilitation, and employment services, and more. While programs have been established and benefits are provided to veterans, rates of unemployment continue to increase. The unemployment rate for veterans can be contributed to the lack of preparation and guidance as individuals transition to a civilian lifestyle.
Veterans continue to complete transitions without sufficient knowledge of the array of benefits available to them and continue to have problems obtaining civilian employment. The authors conducted a scoping review to identify key barriers to veterans obtaining civilian employment. Occupational therapists can work to improve the access of programs and services in place for transitioning veterans by identifying factors that contribute to veterans' continued unemployment.
Within our methods section, the articles included are all peer-reviewed texts published between 2010 and 2020, discussing the various challenges and barriers veterans face while transitioning to civilian employment. The researchers used the CINAHL Complete database in their review to acquire applicable literature. Search syntax phrase searched keywords include veteran employment, veterans and occupational therapy, veterans and employment transitions, occupational therapy and veterans transitions, and veterans and transitions. The research included articles based only in the United States, and veterans must have served at least one deployment.
So our search produced a total of 2,032 articles matching our search syntax phrases. The researchers screened 164 articles and excluded 154 articles that did not meet the inclusion and exclusion criteria. The researchers included 10 articles in the literature review that met the inclusion criteria. To effectively address veteran unemployment, barriers to employment must be identified. The literature suggests that veterans face personal barriers, transitional barriers, and organizational barriers when seeking civilian employment.
Personal barriers for veterans seeking civilian employment include attitudes, behaviors, and life experiences.
Transitional barriers are obstacles that hinder a veteran from moving from a military lifestyle to a civilian lifestyle.
Organizational barriers are hindrances that occur between the company or employer and the employee.
We interpreted the research and found that veterans have expressed that the programs lack organizational structure, lack knowledge on transitional education, and have negative attitudes towards those with mental illnesses. These barriers have resulted in many veterans refusing to receive or seek additional transitional service.
Based on the barriers identified throughout the literature, veteran employment reintegration is an emerging practice in occupational therapy. Veterans are seeking to improve their transition to civilian life, but come across various barriers that inhibit successful transitions. Occupational therapy practitioners and students can work to conduct research and develop evidence-based interventions to best address these common barriers. Further development of Veterans Affairs training protocol for employees should be addressed to improve the overall quality of services and increase veteran satisfaction with services delivered.
The strengths and limitations of our research provide information over the qualitative research articles discussing the challenges encountered by returning veterans through open-ended questionnaires, surveys, and interviews. These methods allow the researchers to obtain direct excerpts from respondents to depict the areas of concern within the overall transition process. The results of the selected articles indicate potential areas to focus to eliminate barriers.
Through new research, programs such as Veterans Affairs can explore various methods that could improve service delivery and client outcomes. We recommend that interventions targeting relationship development and maintenance for veterans are further established as socializing and participating in relationships is recognized as a high-ranked occupational performance challenge in the Veterans Survey. Future research should also focus on addressing planning, preparation, and task initiation skills before discharge to understand the impact of intervention better before the civilian transition occurs.
To conclude, the scoping review highlights veterans' many challenges as they transition to the civilian lifestyle and seek employment opportunities. Some obstacles include mental health problems, lack of transitional support and information, limited work-based training, and poor leadership. The barriers result from the lack of preparation, communication, and resources typically provided by Veteran Affairs. Identifying clear barriers assists occupational therapists in establishing interventions and compensatory strategies for this population. With the proper resources, support systems, and employment training, the quality and access of veterans' transitional services can improve tremendously.